Hey guys, Dr. Joe here. Today we're going to talk about fawn care. Right now is the season for the babies, and it's my favorite time of the year. And the most important thing to do is to build a strong immune system, because a healthy fawn will create a healthy adult, which will give us numerous years of productivity in our deer. So first of all, fawns hitting the ground, what do we do? Everybody has their own regimen, their own protocol, what to do. I'm not telling you or advising you to change anything you're doing. I just want to shed some more light, some information, and try to simplify it. One of my favorite philosophies in life is KISS, keep it simple, stupid, and that helps me out a lot. First of all, when the fawns hit the ground, we get our hands on them. I like to do that within the first 12 to 24 hours, just to go ahead and give them a lot of different products. A lot of people have their own regimen, once again. What I like to do, first thing is get to a fawn. I like to do a quick physical exam on him, make sure everything looks good, his belly button's closed, make sure his feet look okay, try to find any gross defects right off the bat. The next thing I like to do, I like to get strong tinctured iodine. It's a 7% iodine you can get from your veterinarian. If you have troubles, contact me. We can get you some of that as well. I like to spray the belly buttons. The 7% iodine will stain that belly button and almost turn it to leather. Also, when you ear tag these guys, it leaves a little hole, and that hole sometimes is a little wet and weepy, and infection can get in there and cause infected ears. So I like to spray that ear with that strong tincture as well. Second of all, I like to give about a half a cc to a cc of vitamin B12. You can use B complex, that's fine. I like the B12 just for the energy, because we want these guys to have a lot of energy and thrive, so we can get them up, or they can get up and start nursing. The vitamin B12 I like to use, you can get it from your veterinarian as well. Of course, this is a prescription. This is vitamin B12. The 3,000 micrograms is one of the best and probably the least expensive. Half cc to a cc depending on the size of your fawn. The next product I like to use, a lot of people have heard of. It's called Equalizer C20. This company produces a lot of Equalizer products. The one I like to use is the C20 though. 1 cc by mouth within the first 12 to 24 hours is ideal, and we'll explain why here in just a minute once we get through with all the product information. This product has E. coli, it's got rotavirus, it also has clostridials as well, and that's what the C2O stands for. The other thing is there's a lot of pastes on the market, and of course the product I like is the Enable Fawn Boost paste. If you're not familiar with this is new this year. What I like about this product is it's got prebiotics, probiotics. It also has a lot of dextrose. Dextrose is a longer lasting sugar than a simple sucrose or glucose. I like this product because it gets the blood levels high with the sugar content, gives them a lot of energy, so they want to get up and nurse more. The most important thing we can get these guys to do is nurse within the first 12 hours so we can get the colostral antibodies from the mama to build their immune system. And remember, once again, when fawns are born, they have a naive immune system, meaning they don't have anything at all. They're as sterile as can be. So they're going to pick up their immune system from their mother. Unlike humans, dogs, and cats, the placental arrangement does not allow them to have an immune system immediately when they're born. So they have to drink their mother's milk, the colostrum, which is the first milk, which is very rich in antibodies. That's why vaccinating fawns is not the #1 thing I like to do. When you vaccinate fawns and you put a needle in them, they can get vaccination reactions, they can get real sore, it can make them lethargic within the next 24 to 48 hours. And what did we say was the most critical time right now is to have them nurse right away. So if they're sore from vaccinations and stuff like that, they're not going to want to drink, they're not going to get the colostrum, then they get what we call failure of passive transfer. In other words, they have no immune system. And remember, difference between antibodies, like in colostrum, and vaccinations, there's two main things. If you were to give a fawn a vaccine at a day of age, they have no immune system to respond to it, so you may not get any response at all, any positive response. The negative, you'll probably get a sore fawn that doesn't want to get up and nurse. The other thing is if you have somewhat of an immune system and you give a vaccine, it takes a minimum of 3 to 4 weeks to build antibodies to that vaccine. That's the difference between colostrum and the vaccination. So when you give colostrum or you give the Enable Fawn Boost, the Enable Fawn Boost actually has antibodies already in it for E. coli, salmonella, rotavirus, coronavirus, and the clostridials. And of course the E. coli, there's 2 different strains of E. coli antibodies. So by giving the antibodies at a day of age, what is that going to do? Mama is going to provide a lot of antibodies to begin with through her milk. And how do we make her colostrum strong? Vaccinating the mamas in March and April as late as we can, about 60 days prior to fawning, as long as the weather is conducive. We don't want to stress the mothers out too much as well. So if we can vaccinate mamas in the fall when we go to put cedars in them, and then we'll give them another vaccination in March to April, so about 6 months. So deer should get vaccinated twice a year. By vaccinating mom late in gestation, those antibodies will build up and actually go to the milk. So when those fawns nurse, they're actually biologically vaccinated through mama. To me, that's the safest and the best way to create a super immune fawn. So at a day of age, whatever vaccinations the mom got is basically going to fill into the colostrum and build a healthy immune system. But what are some of the other problems that we face with the fawns at a day of age is they're going to be in the environment. So in the environment, they're going to pick up bacteria as well. Such bacteria as E. coli, salmonella, the clostridials, stuff they may not get from the mom's colostrum. So that's why I like the Enable Fawn Boost paste, because it already has those antibodies. Those antibodies could typically last 3 to 4 weeks. So what is the interesting thing? I like to combine colostrum type fawn paste with a vaccination. Now the advantage we can have on fawns within the first 24 hours is they are able to absorb large proteins in their small intestine, because that intestine is porous, meaning it can absorb proteins bigger than it normally would. Now, colostral antibodies are probably the largest protein sources that the animal takes into the body. So vaccinations can be absorbed by the small intestine and enter into the bloodstream. And once again, those antibodies won't be produced to that vaccine or be efficient for the next 3 to 4 weeks. So as mom's maternal antibodies are being used up over the next 4 to 8 weeks, as well as the Fawn Boost paste is going to be, those antibodies will be wearing off in about 3 to 4 weeks, the vaccine will actually start taking over at that time. So they overlap real well. So it is one of my best intentions, one of my best suggestions is to give that Equalizer C20 along with Enable Fawn Boost paste at a day of age so you get the overlap. Also, one of the big caveats, one of the warnings that I worry about is when we start vaccinating fawns a whole lot, besides causing vaccination reactions or making them real sore, they don't want to get up and eat, is vaccines can actually interfere with the maternal antibodies. The antibodies that the fawns get from their mama through their colostrum builds an immune system in their body, and by giving vaccines, we can actually interrupt that maternal antibody, and instead of having the antibodies last up to 8 weeks, we could cause that immune system to pretty much crash. So that's one of the biggest fears that I have. So I hope this helps a little bit. Each week we're going to try to come up with some more suggestions and some more of these videos, and it'll get more professional as time comes by. Forgive me for that. If y'all have any questions, feel free to holler at us. You can contact me by email at drjoeables@yahoo.com, or just visit our website at www.enable-usa.com. And we're here to help. So just give us a holler. If you have any questions, feel free to holler at us. Good luck and God bless, and I hope everything goes great this spring.